Hi everyone, welcome back. I know I haven't been on or posted a video in a while, but I've been doing my Nursing 6, which is the first 5 weeks of nursing school. It has been about 90% online, so I've been doing all of the lectures, most of the skills. You have to submit videos and do everything online. Interacting is a lot of Zoom meetings with my class as a whole, and then we have miniature clinical cohorts within that. So the first 3 weeks were really, really busy. We had new lectures, new skills, new videos that we had to post those first 3 weeks. The fourth week, we actually kind of came up for air a little bit, to where we were just doing a lot of review and just maybe 1 or 2 skills that we were learning. And then I'm on the 5th week right now, so this is the 5th and final week. We'll be going onto the campus at least 3 days this week to do practice and validations. And our final day we'll be going in our uniforms to get those checked off and make sure that we're all ready for clinicals, which I won't be starting till January. It is September 12th or 13th, I think, right now. We won't be going until January because they do not have clinical site approval for our current class group. They are just finishing up with a few people who are in Nursing 14, which is the next group ahead of us. But my class is the last class that actually got in, and we have to wait until January in order to be able to go to clinicals. So when we start in January, it'll be sort of like we're doing a semester and a half worth of work, because we'll have to add that Nursing 14 onto it. But so far, it has been really good. It has been a lot of work because it's more self-taught than clinically taught when we're going to the skills labs. We have been learning everything. First, it was hand hygiene is the most basic, most important skill that we learn, I think, and that is the first one that they teach you. And it ranges from hand hygiene, oral care, peri and cath care, vital signs, elimination. There's a glucose workshop I have to do this week where we have to learn how to take and administer a glucose test, so that way we can explain it to a patient if they are going home and have to do glucose monitoring. Let's see what else. Transferring a patient, just learning to use all the equipment that is in the skills lab, because it looks like a little miniature, I would say, hospital room. Basically a little miniature emergency room. It has about 7 beds in each room. And we just learn on mannequins or each other with our masks and our face shields on how to perform all these skills. It's been really interesting trying to get to know my classmates this way. As you all know, it's kind of hard to see somebody smile through a face mask. So just getting people to loosen up and be okay being in close contact with each other, even with the mask and the face shield on, that has definitely been a struggle. We did on, I want to say the end of the first week, we created a group me, which was really, really helpful. I suggest anybody who's in a nursing cohort to do something like that, or a giant group text or an email chain or something, because especially with everything being online, I think it would be detrimental if we did not have that, where we could communicate questions, comments, concerns. Even this last week, everybody was posting about their uniforms, where they got them, where they're getting them sized, where the patches go, because you have to have a patch on them that represents your school. And I just think it was really, really helpful, especially when we were doing the math. So you'll take a math exam the first, I want to say, actually not the first week, the 3rd week you'll take a math exam, and you have to get 100% on it, which I did, thank goodness. But you have one other chance to get 100% on it. So they let you take it, and then the next week, over the next week, they have you do, I think 2 or 3 worksheets or something like that, just to kind of remediate, and then they give you one more chance to do it. And if you fail that, then you're out of this cohort, and you have one more opportunity to come back with the next cohort. So for the people who did not make it this time, they have to wait until fall of 2021 because there's no cohort that's starting after ours because of the whole clinical site evaluations and things like that. So I feel really bad. I know a couple people who were actually in my clinical group that did not make it. So I feel bad for them. And we just keep encouraging them on the group me. We told them they could stay if they want to, just to kind of like get some information to help them. And we're hoping that they do well next fall. But I feel like so far the coursework has been really easy to ingest and digest. For me personally, I've been able to do these first 5 weeks and work at the same time. I work at night, so that has made it a little bit easier, but also more difficult. I work on the weekends, so that definitely helps. But I also have an 8-month-old daughter, so I'm pretty busy, but I do still feel like I can have a life along with doing school. And I'm also taking a extra pharmacology class that they recommended just to kind of keep us current while we're waiting from like the middle of September all the way to January. And also taking a skills lab course so that I can go in to campus and use the skills lab that we've been using just to keep all my skills up to date. So that way when we go in to the clinical sites in January, it is sort of like we never stopped. I'm really hoping to continue with vitals. I would say that's probably, on top of hand hygiene, probably the most important because one, hand hygiene you're going to do with every single patient. Most of the skills you're going to do with every single patient. But hand hygiene is important to do with every single patient throughout the hallways, when you're sitting down at the nursing station, everything, just to break the chain of infection. And then vitals, because it's just really good to get a base or a foundation for each patient that you're working with. There are several different things that you'll be taking. Temperature, blood pressure, pulse, respirations, and pain. Respirations for me, I've been like having anxiety because they want you to count them without the patient knowing. So it's not like you can be like, okay, take some deep breaths for me. I'm going to count your respirations now. The second that you do that, the patient just starts to either breathe really quickly or too slowly, and you want to get an accurate reading. So while you're taking the pulse, count the respirations is what they've been telling us, to kind of like do it on the slide, not let the patient see that you're doing it. So anybody who's just starting, I would recommend looking up how to take a pulse. You're going to need a watch with a second hand. So look up how to take a pulse and practice that on a loved one, family member, whatever have you. And that will definitely really help. So when you're taking the pulse, take that for about 30 seconds and then count their respirations after that for the next 30. And then times both of those by 2, and you'll have your answer for both of them. And then blood pressure, my school requires us to do a 2-step. So we have to put the cuff on an arm and then find the radial pulse, pump up until we can't hear it, and that will be our sort of estimated systolic. And then we do the actual blood pressure where we're listening to make sure that we get a complete systolic and diastolic number. Pain assessments is the subjective category because that is just based on what the patient tells you, and you have to be really involved. If you've never heard of the OPQR-STU pain assessment scale, I would definitely look that up and start going over the questions, because that is what I'm assuming most likely every nursing school is going to have you sort of do your pain assessment on. And it's very involved. Each letter in the mnemonic is probably like maybe 3 or 4 questions. So you want to make sure that you're getting at least 2 or 3 questions from each category just to start getting them in your head, asking people, practice them, like I said, on your loved ones, your family members, anybody you meet, if you can. And then what else? We have one final exam. It's going to be on, I want to say, elimination and vital signs. And then I have Friday is our final validation for vital signs in our pain assessment, and we have to come in our uniforms. So I would definitely recommend getting your uniforms fitted. If you do not and you go in there, they're going to probably have you get them fitted again, because they want you to look as professional as possible. And my school has us wear white. I'm really nervous about that because white is really hard to keep clean. I mean, even this tank top, like, I feel like it just gets dirty so easily, especially with an 8-month-old around. So yeah, just look into what kind of uniforms they want you to get. If there's any patches, where the patches go. I would say really, for equipment, you want to get a really good stethoscope. I have the Littmann Cardiology 4 stethoscope. It just has increased sounds, or increased hearability on the bell side for cardiology, and I think it definitely has a more clear sound than the Littmann Classic 2, and that's just my opinion. But if you feel like you want something that you can hear a little bit crisper sound, I would say that one or the electronic stethoscopes, but you're really going to definitely pay a pretty penny for those ones. And I got my name engraved on it. I definitely would suggest getting your name engraved on it, because I have been hearing horror stories that these things go missing really easily. And you can get like really funky colors, but some other people might have them. But getting your name on it, I mean, if somebody's like, no, that's mine, you're like, no, it's really mine. That is really helpful. A blood pressure cuff, I also would recommend getting something that is a little bit more personal to you. There's tons of different ones out there, so definitely choose one that you like and that you're going to stick with for a while, because you have 2 years of this to go. And what else? I got my own gait belt, just so I can wear it, I guess, underneath my uniforms, just in case. Gait belts are really important for when you're transferring or doing mobility with a patient. It's just a lot safer to have it on them when they're in the hospital, especially if there's any kind of fall risk or there are any kind of mobility restrictions. So I got my own gait belt, and it was really cheap on Amazon. I think it was like less than $10. If your skills kit that you're getting for your school does not come in a duffel bag, I definitely would recommend getting a duffel bag to like throw everything in when you take it to your skills lab. If not, you're just going to be lugging around like 10 different things each time you go to your skill. You're going to need to keep track of your vitals and your skills log. I don't know if it's just particularly pertaining to us because we're doing it online, that we have to keep track of our skills at home, like how many hours we're doing per day or per week. So I do 5 days a week, about 2 to 2.5 hours per day when I'm at home. And then when we're on campus, we're already counted for 5 hours the days that we're on campus, so I don't have to worry about that. So at the end of Nursing 6, you're supposed to have about, I think it's like 80, 81 hours or something like that. So I have to get about 50 of them at home to coincide with the ones that I get up on campus. And that has been, I think, a little difficult, only because when I'm practicing at home, I'm trying to do it on my husband or my baby or like even my dogs. Like, you just have to practice on people, places, and things, inanimate objects, what have you. Like I did an oral care video, and basically you have to get like a cup and a straw and show how you would do oral care and suction on an unconscious patient. So that was a little bit difficult, only because I don't feel like I'm doing the motions. Like, I know that I'm doing them correctly, but it feels awkward to do it on a cup and a straw. So it's like you just want to actually work with somebody. And same thing with the mannequins. You'll learn like range of motion and placement, like different positions that the patients lie in. And that is really awkward to do with the mannequins because they are so stiff. So I definitely would recommend looking up different positions that patients lay in bed and practicing them on somebody in your household. Especially the Sims position. You'll use that a lot for like enemas or to help make a patient comfortable. There's like side lying, Fowler's positions. Look up your Fowler's positions. So just practicing those at home, like ahead of time, I think definitely helps, especially if you're the type of person who you like, not that you want to get ahead, but just you want to be informed. These are things that you can do to kind of make it a little bit easier, or to like know what they're saying, the instructors are saying when you go in there. Because I know I was really confused the first day that we went in. So we had our first full week. And so it was like Monday through Thursday, you just did it at home. And then on Friday morning, we went in, and we had never met the instructors except for on Zoom. And we had been like teaching ourselves these things at home all week. And when we went in there, it was sort of like a, hi, okay, let's do this skill. All right, you're good. Let's go. And so it was just really, I think, helpful if you try to practice them at home, maybe a little bit beforehand, before your semester starts. So look up, I guess, what you would be learning in Nursing 6 is what it's called for us. So it'll be like hand hygiene, oral care, peri and cath care, transferring a patient, assisted devices, elimination, glucose, vital signs. Let's see what else. There's like a ton of them. But those are probably like the core ones that you'll be learning. And definitely the assisted devices, actually. Look that up. There's like canes, walkers, crutches, and how you're going to show them to the patient, how you're going to position them correctly and adjust them for each patient. And look up the different gaits that you will use with crutches. There's the 2, 3, and 4 point gait, and also swing gait. So I would definitely look those up if you want to get ahead. If not, when you start, they're going to know that you know absolutely nothing. So it's okay to go in there and kind of be really shocked at the amount of information that you're expected to remember. That's okay. 95% of my class is moving on to the next section. So that's really encouraging. And I think Nursing 6 is definitely doable. It's more of learning the skills of everything. So you'll learn the basics of the skills that you're going to need to know when you first go into the hospital. When I start Nursing 14, the instructors have told us that is more of where it gets into like the theory and the nursing process behind the skills that you're learning. Like you'll learn the reasons behind most of the skills that you're going to be doing for your first semester. But once you get into second semester, that is really where everything starts to like come together in a cohesive sort of information unit. So don't stress. It's definitely doable. Like I said, you could definitely work through it for the first semester. I'll let you guys know once I get into the second semester. You could definitely have children. And even if you're pregnant and you're going into nursing school, do not worry. We have 2 pregnant women who are in my class right now. They actually got kind of lucky. They're going to be having their kids like in November and December, so like right before we go back to school. But you'll have your spot no matter what when you get in. So even if you're pregnant or you just got pregnant or you get pregnant in the middle of the program, do not worry. Your spot is your spot. That is what the instructors have told us. Like, no one's taking that from you. You're in. So I would definitely just like look that up. Don't stress. And just go in with an open mind. If they give you a list of equipment to get, definitely get the equipment before the class starts. And for books too, all of our stuff is online, so it's not like I really had to get any physical books, but I definitely think that having the physical book would be helpful, only because I'm just like a person who like has to have it in my hands. It's just more comfortable for me to do that and take notes that way instead of doing the notes on the computer. I have no idea why. I think it's just more of being like a tactile learner that way. But other than that, I think it's been going really well. And like, just take a breath. You'll get through it. It's definitely doable. To me, so far, it has not been as hard as all the videos like online, what they tell you like when you go for your nursing orientation. Like, I think that maybe they just did it to try and scare people away, but I have felt really comfortable so far. And just go in with like a learning mindset or a growth mindset, because you don't want to like go in stressed and then you'll burn out a lot quicker. So it's like go in with an open mind and be ready to learn and be ready to work. Like, don't sit down when you're in that skills lab. Like, you want to learn as much as possible now, so that way you can practice it at home And then when you go to your clinical setting, you're going to feel a lot more comfortable with what you're doing. But let me know if you guys have any questions about, I guess, anything or any more skills in depth, or comments, concerns, what have you. And good luck, everyone. You can do it.